you ever heard of HPV or the vaccine Gardasil that is said to help prevent this virus? Do you know how bad it is and how bad the side effects are to these young girls that are getting this vaccine? There are many different types of HPV, and Gardasil only protects against a few of them. HPV is a sexually transmitted disease that almost every person gets at some time in their lifetime if they are sexually active. There are over 100 different types of HPV, and Gardasil only protects against 4 of them. And most types of HPV do not lead to cancer. HPV is spread by vaginal, anal, or oral sex with someone who has already been infected with the virus. People can carry this virus with not even knowing or having signs or symptoms. Ways to prevent getting HPV are you can get the Gardasil shot, but other ways to prevent are condoms, even though they are not 100% effective, and both people should be only having sex with each other, not with other people. A few things about Gardasil. For females and males, it can be given at the age of 9 years old up till 26 years old. So that's pretty young to start giving this vaccine. It is said to help protect against anal cancer, cervical cancer, genital warts, vulvar and vaginal cancers, precancerous, cells of the cervical, vaginal, and vulvar and anal lesions. Males can also get cancer in the anal area, and they can get genital warts and precancerous lesions, and this is also said to help prevent these. It is given in 3 doses over 6 months, and the first dose is whenever the doctor feels he is comfortable with giving it or the patient needs it, and for females, most of the time after they start getting their first period. The second dose is 2 months after the first, and the third is 6 months after the first dose. When getting this vaccine, fainting can occur, so the doctor will ask you to lay down and stay present for 15 minutes after you get the vaccine. The Gardasil does not treat HPV if you already have it or if you've been exposed. Side effects of the Gardasil are pain, headache, fever, nausea, dizziness, fainting, and vomiting. Other side effects that are more serious are difficulty breathing, wheezing, hives, or rash, and you should tell your doctor immediately. If a person gets swollen glands or joint pain, unusual tiredness or confusion, chills, or generally feeling unwell, leg pain or shortness of breath, these are also some very serious side effects of the Gardasil, and that's what has been more common among these young girls that have been getting sick. They've also had chest pain, aching muscles, muscle weakness, seizures, bad stomach aches, bleeding and bruising more easily, skin infections, and some have actually died from getting this vaccine. According to the British Medical Journal, a teenage girl went into menopause at 16 years old after receiving the Gardasil shot. She was having her period normally, and after receiving the Gardasil shot, she continued to have periods, and they became irregular and eventually quit. And she was diagnosed with premature ovarian failure, which is menopause. And there were 3 other girls that had also had all these same symptoms. They were tested for genetic issues, and they were all normal before they got the Gardasil. 90% of premature ovarian cancer is unknown, but since they did the tests on the girls' genetics before giving the vaccine and then also after, they found that it was linked to the Gardasil shot. The American Journal of Reproductive Immunology also backs up the doctor from the British Medical Journal. It says that when they tested the Gardasil shot on the rats, they only tested against male reproductive organs, not female reproductive organs. So they have added the premature ovarian um, diagnosis to the list of side effects. The three also experienced nausea, headache, sleep disturbances, and a different range of cognitive issues. The HPV vaccine has also triggered an autoimmune response. So, do we really know enough about this vaccine? Or why should we start giving this to kids at 9 years old? Maybe parents should be educating their parents or their children on this before giving this vaccine and letting their kids know what it actually is for, and then they can make their decision in the future when they're old enough to do so.